So thank you. My name is Kenneth George. I'm currently the Chief Medical Officer of Barbados. I've been in that position for about 7 years. And a little secret, I was born in Guyana and lived most of my adult life in Barbados. So I take myself as a good mixture between Barbados and Guyana. We have a lot in common, but my primary objective is to ensure that the Barbadian public receives quality health care at all stages of healthcare, whether it be primary, secondary, and tertiary. So this is an important gathering of chief medical officers across the region because collectively we deliberate on several matters of public health interest that affect all persons in the region. And not only limited to the English-speaking Caribbean, so we have Haiti represented, we have French-speaking Caribbean represented, and even Dutch-speaking Caribbean represented. But we are united because the issues within public health are very similar. So for example, during the COVID pandemic, we never got access to vaccines, equipment, and supplies until very late, and that was a red flag. So moving forward, our intention is to plan good public health policy, but at the same time we need to be independent with respect to our ability to act when challenges come our way. So for example, we have discussed so far, the meeting is only about halfway, but we have discussed so far issues of non-communicable diseases, issues of communicable diseases and what is pertinent to the region, like for example, whether it be chikungunya, dengue fever, Zika, those types of things. We spoke briefly about understanding the epidemiology of disease that comes to our region because we have a cruise industry and many of us depend on cruise ships. But with movement of cruise ships and people in the region also comes movement on disease, and therefore we need to be proactive in our ability to manage disease. So there will be several areas to be discussed with NCDs. We are looking at some strategic areas of cooperation. That's a difficult topic for us, but we must have a strategy because the predictions of NCDs getting worse over the next 10 years are very stark to us, so we need to be very prepared for that. So it's been good so far. I've come to many of these meetings. These meetings also serve as a policy springboard to engagement of ministers of health within the region, so that the tricky policy issues that we discuss, we will give support and assistance in helping ministers of health in the region navigate the courses within healthcare.